Hello, welcome to Fertile Minds, and I'm Dr. Andrew Cary. I'm a fertility specialist at Queensland Fertility Group, based here on the Gold Coast. We're going to talk today about a tricky but very important and interesting topic, which is about endocrine disrupting chemicals and how that may affect fertility. What are endocrine disrupting chemicals? In fact, there are chemicals in our environment that do have an effect on our glandular system, what we call our endocrine system. And as a consequence, this can have an effect on a lot of parts of our bodily functions. And this particularly can affect fertility and fertility prospects. There are various chemicals associated with chemicals such as pesticides and herbicides that are present in agriculture, in golf course management, in parks and gardens, that have phthalates and other toxic chemicals that certainly can, when absorbed into the human body, can have an effect on our bodily functions. The trouble is, the chemicals don't have to just be absorbed via the mouth, ingested in other words, but they can be absorbed via aerosols, so through the lungs, but also via the skin. So we do have to pay attention to what is becoming a challenging and more toxic environment that we're all living in the modern world. During their times of trying to get pregnant, they should try and minimize certain toxins that they can have some control over. You want to decrease or stop cigarette smoking. You want to decrease or stop alcohol consumption. You want to decrease or stop the use of cannabis, marijuana, or other illicit drugs. And you also want to maintain a very healthy diet and have good food groups to eat and be as healthy as possible. But less people are aware of the importance of some of these endocrine disrupting chemicals in our environment. There are precautions you can take as an individual. You could, for example, be careful how you store your food in your refrigerator and trying to store food in glassware containers, not plastics. You try not to microwave in plastic containers. You try not to introduce unnecessary chemicals in your cosmetic treatments. But in particular, there are certain high-risk jobs. You know, if you were a gardener or a maintenance worker at a golf course, for example, you would be trying not to be exposed to the toxic chemicals that can be part of maintenance of the environment, the golf course, the parks, the gardens. But you would also simply try to have good and adequate ventilation without trying to be overly paranoid or obsessive and compulsive about your exposure. You're trying to minimize your risk of these substances coming into your circulation. What happens inside the circulation? There can be changes to the endocrine function. There are various glands, the pituitary gland in the base of the brain that sends out hormones called gonadotrophins that then influence the ovaries or the testes to produce their hormones. They can be affected. There can also be what we refer to as epigenetic changes, so that the individual cells can undergo changes that can affect fertility and reproduction. But the bottom line is, simply in the same way as trying to be avoiding exposure to cigarettes, avoiding exposure to marijuana, or avoiding exposure to alcohol, you try and be careful with your environmental exposure. This discussion that we've raised about endocrine disrupting chemicals has raised some thoughts for you and given you some food for thought in how you can improve your environment, it's going to be a topic that's going to be raised more and more into the future. This is a first introduction to it here today. We look forward to you subscribing to Fertile Minds, and hopefully we'll have further discussions about this in the future.